from the campus of the University of Nebraska at Omaha. Consider This, a program of issues and information behind today's news.
Respiratory infections are transmitted between two people when one is infectious and the other susceptible to infection.
When the infected person talks or coughs, they release a mist of particles made out of respiratory fluid that contains the virus. They can throw between 900 and 300,000 liquid particles from their mouth. These particles are less than 1 micron up to hundreds of microns in size. By comparison, the thickness of a human hair is about 100 microns.
One way to get infected is by contact transmission. When you touch a surface that has been contaminated by a virus and then touch your eyes or nose, you can get infected. There is not much evidence at all that this is the way you can get COVID-19.
The second way is when a spray of large particles, like a drop of rain, fly out of the infected person's mouth and land on your eyes, nose, or mouth. To get infected by this route, you must be close up to a person.
The third way you can get infected is by inhaling virus-containing particles that are floating in the air. This transmission route is called airborne or aerosol transmission. Some people think of an aerosol spray can of deodorant when they hear the word aerosol, but really an aerosol is just a bunch of particles suspended in the air.
Hi everyone, I'm Kathy Wyatt. Welcome to the 26th season and this week's edition of Consider This. Our topic, respiratory viruses. Joining us to talk more about them is Dr. Mark Rupp. Dr. Rupp is a professor and chief in the Division of Infectious Diseases at UNMC. Thank you so much for being here. Welcome.
Kathy, thanks so much. It's a real pleasure to join you again.
Thank you. All right, we're going to start with a brief lesson on the respiratory system. So we're going to put up a graphic, and as we do that, tell us what's important to note.
Well, obviously, the exchange of gases and oxygenation of tissues is vital for life. So we have evolved a terrific mechanism to provide that oxygenation to our tissues, which is the respiratory system. And because it's so important, we have an incredible number of defenses that try to keep it healthy and keep it from getting infected. So from the very proximal, we call it, the nose and the mouth, all the way down into the deep lungs, it's just chock full of things that are trying to keep us from having respiratory infections. So the nose and the mouth are tortuous. They're lined by hair and mucus to trap organisms. As you get further down into the airways, you have this incredible mucociliary apparatus, which are these little hair-like cells that are sweeping things up and out of your lungs. You have antibodies floating around, white cells there, all these things that are trying to make the environment noxious to microbes and to protect your airways. And as you go further and further down the airways, they get smaller and smaller until finally they're just incredibly minute, and that's where the oxygen is able to transmit across the membrane, get onto your red blood cells, and then get transmitted to the rest of your body.
Wow, okay, thank you. Now, sometimes viruses do creep in. When that happens, what can happen to what you just described?
Well, some of the virus have direct what we call cytotoxic effects. So they actually damage the respiratory cells and destroy them. In other respiratory illnesses, they're able to get across that same lining and get into the bloodstream and cause disease in other organs. So COVID is a good example of that, where we think it comes into the upper respiratory tract and then is able to many times disseminate to other tissues. So there are direct effects from the virus impacting the cells, and then there's effects further at a distance that can happen.
Okay, how many respiratory viruses are there?
Too many to count. Truly hundreds of different viruses can cause respiratory tract disease. Some of the ones that are most common would be like a rhinovirus that people are accustomed to causing the common cold. There's over 100 different types of rhinoviruses. So that's just one example, and one of the reasons why it's so hard to figure out one medication or one vaccine that can hit all those different viruses.
Okay, for the purposes of this program, we're going to talk about 3: RSV, the flu, right, and COVID-19. Why these 3, Dr. Rupp, and why now?
Well, we're seeing all of them currently circulating in the community. And so this is a very unusual and dangerous situation where we have three fairly, significant viruses. RSV, or what's known as respiratory syncytial virus, which is most important in very young children and then in older individuals. Flu that can hit just about anybody, and obviously COVID-19 that has hit everybody. And so those three viruses are circulating through the community right now, causing a lot of havoc.
Okay, can be confusing though, because these three share some very similar symptoms. We're going to put those up for our viewers. So talk a little bit about the similarities between these.
Well, unfortunately, there's so much overlap between the symptoms. Even experienced clinicians have a great deal of difficulty trying to determine one of these from another based upon just clinical symptoms. All of them can cause some upper respiratory symptoms like a stuffy nose, a scratchy throat, cough, fevers, and aches and pains. That's pretty much common across the board. We've seen particularly early in the pandemic that COVID-19 can cause a loss or a change in your sense of smell or taste. That's a little bit more unusual for flu or for RSV, but can occur. And then what we've seen with COVID is all the other systems that can be involved when it triggers your inflammatory response. And it's well known now that people who have COVID-19 are also having more strokes and heart attacks and blood clots and things like that because of the systemic effects that are there. Influenza likewise has been associated with an increased risk of, for instance, heart attacks. And so these viruses that people think of, oh, they're fairly mild and, I'll just get over them, it's a bad cold, actually can cause some very, very serious toxicity, side effects, morbidity, and unfortunately sometimes mortality. Now, as these viruses get into the lower respiratory tract, then you start seeing the pneumonia that can be caused by them. So people with cough and shortness of breath and inability to oxygenate their tissues, that stuff that we just talked about that's so crucial for life, as these viruses get into the lungs and start to really cause havoc there, then people can really get into trouble.
So one of the things that we should talk about, because I know that there are so many folks on the fence, especially if it's difficult to find childcare or they just have to get to work for whatever reason on a particular day, at what point do we stay home?
Well, the smart thing and the best thing would be to try to stay home whenever you're showing a symptomatic respiratory illness. Even these relatively mild common cold viruses like a rhinovirus, enterovirus, some of those things, you don't really want to transmit those in your classroom or in your workplace. So if you can stay home for just a few days, get over, then come back into the classroom or to the workplace, and we'll welcome you with, open arms, so to speak.
Okay.
Obviously, if you're more severely ill with flu or with COVID, that's even more important for you to stay out of circulation, try to keep those viruses to yourself and not to transmit them to your coworkers or to your classmates.
Okay, so hoping that works out. Unfortunately, sometimes it doesn't, and people need to take the next step, which is seeking the advice of a medical professional. So as you're at home trying to get over what it is that you're getting over, when do you know you should pick up the phone because this is something more serious?
Well, a lot of it's dependent upon your risk classification. So if you're a person who has underlying cardiorespiratory disease, you're getting a little bit older in age, or you have a very young, child just within a few months of birth, those are the real vulnerable things that you want to look for. And it's important, increasingly important, to make sure that we get a hold of those folks, make a diagnosis specifically, because there's good treatment for at least two of those viruses. So flu and COVID, we're able to actually offer people very effective treatment. So it's important, if you're at high risk for having more severe illness, to contact your doctor quickly so that they can define it and get you started on treatment.
Okay. Is there, especially with RSV, especially with new parents, is there something, a warning sign, maybe there is a little cough, a little sniffle, but is there something different, really different about RSV for those new parents that they should be watching for?
Well, any respiratory illness in a very young newborn is cause for concern and probably a reason to call your clinician, your doctor. If the child has any difficulty in breathing, where they're really coughing so much to where they're gagging, or they're coughing so much to where they're just not able to breathe, and you're starting to see any signs that they're having poor oxygenation, so they're starting to get blue lips or turning dusky, I mean, those are obvious, real warning signs that you better seek help immediately. But any illness in a very young child within a few weeks or months of birth probably deserves a call to your pediatrician.
Okay, thank you. Another question that seems to be floating around out there is, can you have more than one of these at any given time?
Well, you can, although it's unusual. And so particularly at the very beginning of, for instance, the COVID-19 pandemic, as it came in and flu season was still present, we did see people who were infected with both viruses. But in subsequent season, that has been less frequently seen. Those people who did have both viruses unfortunately did worse than either virus alone, which obviously is sort of a double whammy. And now occasionally we do see people with multiple respiratory viruses, although again it is somewhat unusual. So you could get somebody with COVID-19 and flu, or COVID-19 and RSV, but it doesn't happen that frequently.
Okay.
Again, that's a reason to get a test, get diagnosed, because again, we want to figure out which virus you have and what treatment you should be on.
Okay, let's talk treatments. So they've come to you, you've diagnosed the problem, so let's start with RSV. Treatments for that one.
Unfortunately, that's a tough one. So there isn't good treatment for RSV at this point. There are some drugs that are in development that look somewhat promising, but if you have RSV, there is not good treatment at this point. There are some things that we can do to help to prevent RSV, and so those highest risk kids can be given a monoclonal antibody preparation if they're going to be within the first 6 months of life during the RSV season, and that will protect them through the season. That drug is fairly expensive, and it's fairly small number of folks that treatment is offered to. What we're really looking forward to with RSV are some of the vaccines that are just on the horizon now. They've done the testing, looks effective in different populations, and so it's been administered to moms so that they'll pass the antibodies on to their young infants and get protected that way. And then it's also offered to older individuals or higher risk individuals to try to prevent disease. And some of those studies look very promising. So this data has now been filed with the FDA. We're hopeful that next RSV season, which is usually in the late winter, early spring, we'll have a vaccine that we'll be able to offer people.
So let's talk about that, your time frame there. Folks are talking about RSV now. They've been talking about it for a little while. Why?
Well, there's a lot of things that we don't fully understand with regard to viral dynamics and the way viruses interact with the overall human population. And I think this is a good example of that. That when COVID-19 came on the scene, it pretty much just pushed all the other viruses off of the playing field. We don't really know how that happens. But subsequently, with the seasons that have come since the introduction of COVID-19, we've started to see the other viruses to come back in and start to assert themselves. So for instance, as you mentioned, we're seeing RSV now, which is typically a month or two earlier than we've seen it previously. Similarly, we have a very early spike in influenza activity in many parts of the country, including here in our Omaha area. So these viruses are showing up earlier than they did previously. We think that's somewhat to do with these viral dynamics between COVID-19 and the other viruses.
Okay, thank you. Let's go back to treatments. So the flu, talk a little bit about that one.
Well, influenza, somewhat like some of the other viruses, you're most at risk if you're at the very young or very older age, or you're immunosuppressed, or you have underlying cardiorespiratory disease. It's important to get diagnosed because we have good oral medications that can be given to people that have been very nicely shown to prevent some of those more severe cases of flu. So important to get that test, specifically know if you have flu, so then you can get started on the oral medications for treatment. There are some other medications that have come out more recently, intravenous forms of the medications, and also interacting with the virus at different stages of its lifestyle. So we actually have 2 or 3 different medicines that can be given now for treatment of flu.
Okay, thank you. And COVID-19, where are we with COVID-19, and then go in a little bit more to treatments on that one?
Well, we continue to see the pandemic evolve, and I'm hopeful that we're sort of at the beginning, perhaps, of the end game with COVID-19. It's not going to go away ever, but I'm hopeful that we'll get to a place where COVID-19 is more or less like the other respiratory viruses, and we're able to take it a little bit more into stride. And I think we're getting that point with the population immunity that we're seeing with so many people who've been sick and so many people who have gained immunity through vaccination, which is by far the better way to go. Mm-hmm. And so I think we are seeing that evolution of the virus and how it interacts with humans. So it's important that people get diagnosed with COVID if they're showing those symptoms, because again, we have good medications that we can give people to prevent them from getting the more severe manifestations of disease, ending up in the hospital or losing their lives.
Okay. I want you to speak specifically for a minute to those administrators, staff, and so forth in the senior living communities, because COVID-19 has just been, as you know, terribly difficult, especially on those populations. Now we're heading into flu season, and you may very well have staff saying, how do I know? And while we've talked about the differences, I would imagine, you know, that there is increased awareness in terms of, okay, what are we watching for here? How do we deal with this to make sure that our vulnerable population is as protected as they can be?
Yeah, well, COVID-19 continues to be amazingly impactful, and I know people are really tired of this pandemic and don't want to pay much attention to this, but we continue to have, you know, tens of thousands of cases per day, and that's clearly an underestimate of what's going on in the community. We have tens of thousands of people in the hospital, and we're still having 300 Americans lose their lives each and every day from COVID-19. It's over 100,000 lives per year, even now where people are thinking that it's at a fairly low level. There's a lot more COVID out there in the community than is being defined. If you look at the wastewater data, which I put a fair amount of stock in, we're way back up again. So there's a lot of COVID in the community, even though it may not be reflected on the public health dashboards. It's important for folks in long-term care settings, as you mentioned, and in other settings where we have vulnerable people, to really continue to focus on COVID-19. Make sure that those residents of the long-term care facilities are up to date on vaccination. And that means not just getting that first series of vaccine, but to get the booster shots whenever they're eligible. And right now, we have the bivalent booster, which has the original virus as well as the BA.5 variant, doing a good job in protecting people and keeping them out of the hospital and keeping them from dying from this illness. So incredibly important to make sure that everybody's vaccinated. If we do have symptoms, we need to make sure that we're getting people diagnosed so that we can treat them and that we can put them into appropriate isolation. And although I know, again, people are very tired of this, I still think that we should be showing some common sense things to prevent the transmission of viruses from person to person. So wearing that mask when you're in a crowded setting, avoiding those settings when you can, makes some sense, particularly if you're at higher risk.
Let's talk about prevention some more, and personal hygiene. You know, back when COVID was coming down the pike, we talked a lot about that. You're not hearing quite as much anymore, and I appreciate you bringing up the whole mask as a prevention too. But personal hygiene, just go through the basics in terms of what people can be doing, small things that people can be doing to make a big difference.
Well, as you mentioned, early in the COVID pandemic, there was a lot of focus on cleaning everything and disinfecting all the surfaces and everything you touch. That is one way that respiratory viruses can transmit. So if you touch something that's contaminated and then you inoculate the virus to your eyes or your nose or your mouth, you can get inoculated that way and can get sick. But by and large, this is a virus that is spread through droplets, people who are close to one another, and then the aerosols that we saw in that first diagram that you had that can be transmitted a long distance. And so those are the ways that the virus is really spread. That's why it's important when you're sick, take yourself out of circulation, don't spread that virus. And again, it makes a lot of sense for folks to be wearing a mask, particularly if you're sick, to keep the virus contained. And then there's also value for the person wearing the mask, that it's going to filter out some of the virus and give you a longer bit of cushion, a little bit more protection. So, you know, we don't see a lot of people wearing masks in the community now. I think that's unfortunate.
Well, and we are heading into the holiday season, so people are going to be out and about, probably in larger numbers this year because of the distance from the start of COVID to now, right? So what kind of advice would you have to people who are going to be, maybe they haven't been out a whole lot, but they're going to get out now because they want to go shopping? The masks, you've talked a little bit about that, maybe avoiding a lot of people. Anything else?
Kathy, one of the things that we've learned here during the pandemic is how important it is for people to maintain their social ties. And so you're right, the first year that we had this, most people didn't celebrate their holidays. But we know that it's critically important for families to get together, for friends to get together, to maintain those ties. And you can do it and do it in a manner that's fairly safe now. Okay, so the first thing you want to do is, before you're coming up on a big event, a family event where you're going to get a lot of people together, tell folks to use some common sense, to you know, show some discretion in what they're doing so that they're less at risk of contracting the virus. If you're sick, don't show up. And then everybody can also get an at-home test kit, and that's just one more protection that people can use. They can test before they go to their family event, make sure that they're not unwittingly shedding this virus. They're not perfect, but it is one more, you know, protection that you can build in. You know, obviously having people use a little good hand hygiene. There are some simple things that folks can do at home to help improve ventilation, and that also increases the safety level.
Well, it might be a good idea to remind people of technology as well. I mean, we've come a long way with something like Zoom. So if you know that somebody's not feeling well, or you're going to have a family member who is in a senior living community, there may be a way to connect through technology too.
That's one thing that we've obviously learned. So we're conducting business, and we can also use those for some of our social encounters as well. So if you are sick and you still want to interact with family, rather than coming to the Thanksgiving dinner and, you know, spreading your virus, it would be much better to connect with folks via, you know, a technologically sound way.
Okay. You have touched on vaccines throughout this interview, but at this point, maybe just summarizing what is available in terms of RSV, the flu, and COVID-19.
So currently RSV, we're looking forward to having some vaccines on the near horizon, both for moms and for older adults. Maybe next season we'll have those. For flu, that's a vaccine that's been given out for decades now. We know that it's safe. Not a perfect vaccine by any means, but in any given year prevents about 50% of influenza. So again, not a 90% sort of protection, but it's the best tool that we have to prevent flu, and well worth it for everybody to get that vaccine. The public health services recommend this for anybody who's older than 6 months of age. And in particular, if you're at high risk, you should be getting the flu vaccine. And then obviously the COVID vaccine have been tremendous in really helping protect people and keep them out of the hospital and keeping them from dying from COVID. Those likewise, you know, we've given billions with a B doses of COVID vaccine now throughout the world. We know clearly that they're safe. We also know that they're effective. So this is something that I would strongly recommend for any of the viewers, is to take advantage of that bivalent the booster now, and if you're eligible, to get that.
Okay, thank you. Given all that we have talked about today, knowing what you know in your world, what is the most significant concern among healthcare professionals with these three viruses right now?
Well, frankly, you know, the healthcare system has been under siege now for going on 3 years. And there's an awful lot of healthcare providers that are pretty frayed at the edges. We're going to keep doing our job, and we're going to do the best we can, and we'll keep doing that as long as it's humanly possible. But clearly there are ICU nurses, emergency department personnel, respiratory therapists that have been working nonstop for years now. The system doesn't have a lot of surge capacity. And so any one of these 3 viruses can come in and put a lot of pressure on an already stressed healthcare system and just make it that much harder for us to provide the care that everybody expects and needs when they need it. Because unfortunately, those things that always are going on, people getting into car accidents, folks having heart attacks or strokes, people needing surgery, we want to be able to provide those services. And when the services are stretched because there's also an onslaught of people with COVID or flu or RSV, it just makes it that much more difficult.
Okay, thank you. In the minute or so that we have remaining, talk about, we're talking a lot about viruses these days. What do you see as you look down the road from where you're sitting? Where is your head going with all of that?
Well, this COVID-19 pandemic should have, again, been a real warning bell for folks to understand that, new and emerging infectious diseases are going to continue. We're going to see more pandemics in the future. Being as prepared as we possibly can, really strengthening our public health system is all going to pay off for us. And, the COVID-19, as bad as it was, isn't as bad as, a new virus could be. And so people really do need to think about that we want to have strong systems in place so that we'll be able to weather that storm if and when it comes.
Okay, talking with Dr. Mark Rupp today about respiratory viruses. We're going to put up a graphic for our viewers, for people who may be wanting more information about this topic. You can go to cdc.gov, that number 800-232-4636, nebraskamed.com, which is 402-552-2000, and finally the American Academy of Pediatrics. That website is aap.org. Dr. Rupp, thank you so much for joining us today, for sharing your time and expertise, for all that you and your team are doing on an hourly basis for this community. Thank you so much.
Kathy, again, thank you for giving me the opportunity to be here on your program.
You bet. Thanks to our students who are working so hard behind the scenes, and of course to all of you for watching. As we close, scenes from the Sack Museum, as seen through the lens of Wyatt Moravec, a junior here at UNO. We'll see you next week.
Consider This is an issues and information program produced by UNO Television. More information and program archives can be found at nebraskapublicmedia.org/considerthis. If you'd like to share your comments about this program, call UNO Television at 402-554-2516 during regular business hours, or send an email to cwyatt@unomaha.edu.